Today, the hockey community has been met with some very saddening news. Timur Faizutdinov, a 19-year-old Russian hockey player, has tragically passed away after a head injury kept him in a hospital for 3 days. Now, many of you may be wondering what went on and how did he succumb to such an ending? I wanted to take you through the head injury itself, things we look for, and then discuss whether or not this is something to be worried about at a larger scale. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. On this channel, I break down injuries as they happen so that average fans can better understand what's going on. If you want to stay up to date, be sure to like and subscribe. For now, I'm going to go back to reviewing Timur's devastating injury. So we do have some video footage looking at the mechanism of injury and showing us exactly where Timur was hit in the head, because it'll allude to kind of the things I want to talk about in more detail. So you'll see here that the forward is essentially just trying to, he's pretty much a wrist shot of the puck into the net, pretty much across the blue line. And that, well, you can't see it clearly, impacts Timur on the side aspect of his head. So you're thinking kind of on that area of the temporal bone and just behind it. And if you see right after, he falls right down. So the one concerning feature is that once he's on the ice, he's having a very hard time getting up, and one where, he's not able to get up and they had to take him out on a stretcher. That's something we look for as healthcare providers on the side. If our players are not getting up, it's a sign of severe head injury and we need to rule that out. News reports state that Timur was in hospital for 3 days battling for his life before succumbing to his injuries. So what happened and what things should be worried about? So the number one thing that we should be worried about when it comes to that type of injury with the puck to the side of the head, even though he was wearing a helmet, is blunt force trauma. We know that hockey puck slap shots can go 100 miles per hour plus. Even a wrist shot has quite a bit of a bite to it. And despite helmets being protective against kind of your acute trauma, so skull fractures and so forth, blunt force trauma can still do a lot. So even if we're wearing protective helmets, we can still transmit the force through our head. And one of the main areas that we're worried about is intracranial bleeding. So there's two main types of bleeds that we'd be worried about in Timur's case. The first is a subdural hemorrhage, so a bleed just outside the brain matter, and it actually looks like this on a CT scan. The second, and the one I'm more suspicious of, is actually an extradural hemorrhage, and that's one that's an epidural bleed. Essentially, it's a bleed just outside of, just above the level of the dura, and it looks like this on CT scan. Why would I be worried about that? It's mainly because of where Timur was hit. So if we look here, this is the scalp. And on the scalp, you can see that this here is the side aspect. And this was the area where he had that injury to his head. And if I turn this around, there's an artery right underneath, which is called the middle meningeal artery. And you're going to see that in pink right here. This artery is one of the most common causes of an epidural bleed and can lead to death afterwards. It's something that we'll see a lot in boxers who have acute kind of blows to the side of the head. They're a little bit dazed, they may have lost some consciousness, but they're okay for a bit, and then it's afterwards where that bleeding builds up, that epidural bleed, and causes that acute increase in brain pressure. And really why brain bleeds are so devastating is that the bleed in the brain causes an increase in pressure, and the skull is a finite space. So if it can't go up, it goes down, and going down can really harm the spinal cord and can cause acute fatalities. So in most cases, in these cases, surgeons would try to decompress the skull to give the body that extra time. The other thing that could be a potential injury mechanism for Timur was that he could have had a depressed skull fracture. So even with a helmet, that blunt force trauma could have caused a fracture to the skull, depressing it into the brain, causing that bleed. Now, many of you may be, asking yourselves, I'm 19 years old, I'm 20 years old, I play hockey, is this a danger to me? And I mean, at the end of the day, as you can see, it was a fluke shot. We are banning cross-checks to the heads. We are banning, for example, full contact sports in the Pee Wee division, just to avoid undue head trauma. A head trauma like this, with a helmet on to an area that was protected, it's a tricky situation. It was much more of there was a wrong place at the wrong time scenario. Much like we can hit our heads when we go across the street or get hit on a bicycle, for example, or even fall skating on the back of your head, you are predisposed to the same forces that could cause similar things. Unfortunately, in Timur's case, there was just a lot of bad variables, which ultimately resulted in his tragic passing. And I think the important things are to really know the signs and symptoms of an acute head injury. If you feel fine, you get up and you walk away, but a few hours later, you feel terrible, nauseous, vomiting, don't be afraid to go and get help. And I think that's the most important thing I want to tell people in these videos. I want you to be able to play sports and to be able to play sports safely. Just know the signs and symptoms and really be educated on it, because we don't want to see too many more of these cases. I mean, the medical care that Timur got was gold standard. He was taken care of and he was in ICU. But at the end of the day, if you're worried about a head injury like this, just make sure to get checked out. If you have any questions or comments about the video, or any questions or comments about Timur's case, leave them down below. If you like this video and want to stay up to date on my latest content, please like and subscribe to my channel. For now, that's all.